we can move now to a related issue on also on shortages, which is to analyze the feedback that we have received on the pilot, collecting information from eligible organizations on shortages. And we have been working on it. Inga Abed will present this. Thank you, Inga.
Thank you, Juan, and good morning, everyone. It's a pleasure to be here this morning to give you an update on the pilot, which has run for the last 6 months, and to give you feedback also on, well, not feedback, on the plans on the proposed next step. So just to remind everyone, the pilot was directed to, or is directed to, eligible EU patient and healthcare professional organizations, and it gives the possibility to report to EMA shortages that fulfill certain criteria. So shortages that affect one or more EU member state and where the medicine in question is critical, i.e. a life-saving medicine without a suitable alternative, or where the alternative has a clinical impact, or in the context of a public health emergency, any information that could indicate an upcoming shortage. So what happens to the reports? We check them if they fit the criteria. Any reports that meet the criteria and that have not previously been discussed at the SPOC working party, or that provide new information, will be forwarded to the SPOC working party for assessment. So this is a slide that's very similar to the slide Monica has presented. So it's just to show you the SPOC working party functioning as the engine in terms of monitoring of shortages and the different interactions. So in relation to the routine monitoring, what does the SPOC working party do? They raise critical shortages in their territory as to establish the extent and impact of these shortages across the EU, and to decide if there's a need for EU coordinated action, and what specific actions are needed, such as engagement with marketing authorization holders and manufacturers of alternatives, as an example. So the SPOC working party meets regularly. The agendas and minutes are published. And also just to mention that the minutes detail the shortages and provide information about those specific shortages that are under continuous monitoring. So what happened during the pilot? So the pilot started in December last year. So far, we have received reports on 33 active substances from a total of 5 organizations. Most shortages are actually nationally authorized medicines. Only a very small minority are centrally authorized medicines. If we look at the results in closer, so shortages of 12 active substances were already known and actively monitored through the SPOC working party. For 6, there was a previous feedback from the SPOC working party. 4 were not monitored as such, neither currently nor previously, and were sent for active feedback to the SPOC working party. And then 8 were not escalated because they were not critical, and 3 required more information. So on the following slides, I have detailed the actual medicine shortages that were received and grouped them. So just to say, so this slide shows the shortages that were actively monitored at the time of reporting, and the ones highlighted in yellow are the ones that were also reflected in the EMA shortage catalog at the time of reporting, and most of them were reflected in national authorized catalogs. So this list shows the shortages that were sent for active feedback to the SPOC working party, so they were not previously raised. The feedback suggested that the shortages as such are not either not critical or are being resolved or were being resolved at the time of reporting. So the feedback was there was no need for further coordinating action, and the shortages are being continued to be monitored at a national level. So this list groups the shortages which had previous feedback from the SPOC working party. So in those cases, we looked through the reports for new elements warranting a new consultation. In general, the reports were complementary to the SPOC feedback received. There were some slight differences in extent, but no further consultation was thought necessary for those shortages. And then we had the shortages that were not escalated because for most, the report themselves actually listed that alternatives were available, in which case, they didn't fulfill the criteria, and but obviously they are monitored at national level. So there was one exception, which was oxybutynin, which was highlighted as critical by the organization, and which we followed up with the marketing authorization holder, because it's a centrally authorized medicine, and which in this case, actually, it was being resolved at the time of reporting. So we did not escalate this further. And then there were the reports that were that required further information because at the time, they did not include sufficient information on the extent or the date. So in terms of the assessment, the reports are mostly nationally authorized medicines. 3 were centrally authorized. Most shortages were known. Reports were confirmatory with some additional information on extent and consequences. There were, so in total, there were 10% of reports that were escalated to the SPOC working party, 50% led to a SPOC were actually consulted at the SPOC working party. There were some differences in the criticality assessment between organizations and SPOC working party, but this reflected represents also the subjectiveness of the criteria used. Some of the problems to highlight is that some of the reports did not provide enough information on the shortage, such as the formulation or the name of the medicine, which is very important to highlight. Some reports were of long-standing, well-known shortages, and they are reflected in national catalogues. And then reports included shortages with alternatives, and as such did not fulfill the criteria for escalation. So one take-home message as well is that earlier communication and more information from our side is essential to better identify and streamline the shortages that should be reported. So in terms of next steps, so the plan is to continue the pilot, where we would propose to adjust the criteria to limit it to shortages affecting 2 or more member states, and where the medicine in question is critical and defined as disease with serious implication for health without a suitable alternative. And then also where the shortage is not already listed in a national shortage catalogue. And to finish, I have just a slide here just to give some key points for the reporting. So it would be good to use the template to report and to consider certain questions. So if a national organization reports a shortage, other organizations reporting similar shortages, are the shortages reflected in respective national catalogues, and only report if shortage affects 2 or more member states, or if the shortage is current and started recently and not yet reflected in national catalogues. And then just finally, just to highlight that reporting the shortage to EMA is for the purpose of additional coordinating actions through the Spoke Working Party. And this will be in addition to the actions at national agencies that will be ongoing. So maybe I'll stop here and see if you have any questions or feedback.